So, good morning again to everybody and to the essential employees and to now all the non-essential employees starting to be phased in, coming back to phase 3. Welcome to the new world around us. And again, thank you for doing the right thing and staying home and taking the advice of Dr. Welling and myself about how we can do this going forward and do it in a safe manner that we can start to reopen up. And now we're looking forward to phase 4 so we get everything back and get our malls back online and get everything out going. But some really good stuff. Our numbers are really staying in the right direction. Today, we only went up 2. We're at 1,837 positive cases of the coronavirus in Albany. We have 173 people under mandatory quarantine. That's down by 68, which is good news. And we're staying at 1 person for precautionary quarantine, which is also good news. Out of the 5,503 people under who have completed quarantine, that's down 56 actually from yesterday, and out of those, 1,775 tested positive for the virus. 47 have recovered from that number too. So that's also great news, going in the right direction. There's 7 people in the hospital. That's down 3 from yesterday, and our hospitalization rate is 0.38%. And yesterday it was at 0.54, which is also good news. And Dr. McKenna was on 1300 today, and he talked about how they're knocking down, or they're stopping their EOC at the hospital because things are going right there. And it just shows you everything's starting to get back to not to the norm where we were when this all started 90 some days ago or 97 days ago, but we're getting back to where things, the way we reimagine the workforce looking and everything outside being is how we're going to start going forward. But we're starting to get to a little bit of normalcy. We have actually 0 people still in the ICU, which is good, and the 5-day average is 3.6, which the last one was at 4.4, and before that it was at 3.8, and we went up a little bit, so it's good. We're at 3.6. I continue to tell everyone out there, please get tested. We're at the point with our mobile testing sites. If we don't get more people signed up and coming to them, we're going to make the decision to shut them down because we're not getting enough people, and there's a lot of resources and a lot of logistics to have them the mobile testing sites throughout the community in downtown Albany. And if we're not getting people to get tested, it makes no sense to continue that on. And Whitney Young's been a great partner. I can't thank them enough for their professionalism in what they were doing, not just here, but in Rensselaer County. So thank you to Whitney Young and the whole staff there at Whitney Young. But also tomorrow, I have announced it before, I just want to remind the viewers out there and the listeners to this, tomorrow 9:30 a.m. to 1, you can get a test at the Times Union Center. You have to call, and the number is 518-465-4771. 518-465-4771. And again, it's for anyone coming back to work that started yesterday or alternate work schedules, whatever your company works it out. If you want to come down and get tested, it's going to be at our TU Center in a controlled environment inside, because it's supposed to be 90 and humid tomorrow, so which is also good for the people giving the test, have to be in the suits. As always, you can go to UAlbany for the essential workers too, to the Seth Q Arena to get tested, and in the drive-through as always, and that number is 1-888-364-3065. And I know the numbers there have been low too. And the Rite Aid in Colony and Central Avenue, as always, go to riteaid.com and sign up on the website. That's starting to slow up. I mean, it's good, but I continue to say this, and Liza continues to say this. The virus is there; it didn't go away. And I'm not trying to scare people. The numbers are great. I know a lot of people were talking about the protesting and everything else going on. Numbers are staying great. That's a good thing. And we're hoping not to spike up and go into the other direction. I know people like the fact that we're in the phase 3, and they're liking that they're getting some type of normalcy back in their day. But as a member of the regional control room, our numbers, like I said, continue to get better. We're staying low, and recoveries of those who have tested positive, over 90% have recovered, which is good. News on the antibody testing done by the state shows we have a slightly higher percentage, with a 2.5% of the Capital Region residents tested showing antibodies. That's up from 2.2 when the state did the random testing before throughout the different supermarkets, so which is good stuff. Again, I like to say it is phase 3, so welcome to phase 3, everybody. It's 14 weeks into this. I know everyone's tired, and we're glad we're getting to the point where we can get back to being normal. Things every day and later this week there will be more changes that will be coming out of the control room when we have meetings with them. And on this Friday, I just want to remind everyone, hospitals and group homes may begin and allowing visitors. They have to take their temperatures, use the proper PPE type of stuff. Nursing homes, no. We haven't gotten any guidance on nursing homes, and jail visits have been no so far. So they're the two big ones we keep asking every day, and right now there's no guidance on that, and they're not allowing it. Again, to the consumers and to the workers out there, now that the restaurants are open and enjoying it, please, by all means, you have a right to be trained on the safety plan. You have the right to look at the paperwork and make sure people are doing the right thing. And, if you do get into a confrontation with somebody, better to take a step back, take a deep breath, and walk away. I know everyone's a little tense being home for 14 weeks or 13 weeks in certain cases. It's different. You come out, and I know the tensions are high. I know a lot of people don't like wearing masks. I get it. I know you don't want to wear it for 8 hours, but by doing the right stuff, we're keeping the numbers down, and it protects the people around you. When you're not around anyone, take it off. I get it. And to the workers that have to wear masks all day, I get it. It's hard, and I know people don't feel confined in them. I don't know what to say other than saying it's just the way it's going to be until we get an antibody for this, and that we can have a vaccine where we can move forward. So, again, please. So I also want to remind people, you can start picking up hand sanitizer from the Times Union Center. You go down Market Street, it's in the back of the Times Union Center, to the businesses out there, to the churches out there. The state of New York dropped off pallets to us yesterday, and they're going through the EOC through the Sheriff's Department, but they wanted to make it easier and have a downtown location, so we're doing that. Please, by all means, come pick it up. You can get 2 bottles of hand sanitizer, the big jugs, for your companies, and again, people are using them, so please, by all means, come down and get it. And also, the complaints that are coming in, I get it. There's a hotline you can go to. You can go onto their website. It's My License, and it's .com. I got it up now. Or you can call, write the number down. You can call 1-833-789-0470. Please call or go online and make a complaint if you see something not being done right. Because again, it's up to us to police each other and do it in a nice way. And again, if it gets to be confrontational, just walk away. There's no sense of arguing with people because again, people are tense. But I want to say thank you to everyone doing the right stuff out there and keeping our numbers down. Dr. Whalen.
Good morning. So again, I think the numbers are encouraging, and it is encouraging that we are able to move forward with reopening at phase 3 level. But I need to continue to reinforce the need for caution. If we look at other areas in the country, we have seen that reopening can be tied to spikes in disease. I don't think this needs to happen. I think people need to realize that reopening is not flicking an on switch. It's a dial of continuum. We know that COVID is not gone. We know that it's still within the United States. And the information that we've received from the state antibody test, if we look at those numbers, 2-point-something% of Albany County or upstate capital region residents have shown antibodies. That means that in excess of 97% of us are don't have antibodies and are susceptible to COVID-19. So it's important to remember that we need to continue to protect ourselves and to work collectively to ensure that we are all remaining responsible with the behaviors of utilizing masks and hand sanitizer and distancing. As we return to the workplace, it's incumbent on companies, restaurants, businesses to ensure that they're following state guidance for spacing people out, for still conducting meetings through platforms like Zoom and others so that people can be distanced, and just really phasing in the behaviors and keeping a close eye on the numbers. We'll be continuing to monitor these things on a daily basis. We are continuing with all positive cases to identify contacts and ensure that they are appropriately quarantined, and we'll be reporting the numbers out as we learn about them going forward.
Thank you, Liza. And also, we have been lobbying every day on our control room meeting to open up malls and the businesses inside there. Like I said yesterday, there's over 700 employees waiting to go back to work and can't go back to work until malls are opened up. And obviously, with this hot weather coming up the next couple of days, which is nice, people are probably going to stay a little cool. And what better way to do that to walk around in the mall? But we continue to talk about youth sports. And right now they're saying when we get into stage 4, starting July 1st, if everything goes well, it would be after the 6th. And I can say this, and I don't, football, stuff like that, basketball, lacrosse, soccer is probably not going to happen this year. I mean, they're pulling back on a lot of that stuff. They're going with sports that there's not a lot of contact with. And I know that's not what the football season wants to hear. I know that's not what other sports want to hear. But I would just plan on that. It's tough. I've talked to a lot of coaches out there that want to get the kids. They want to get the kids out there training. The parents want to get the kids outside, enjoying the nice weather, but seeing other kids and socializing. And we got to do it in the right way moving forward. So I just want to keep people up to date on that stuff as we continue to move forward. DMV is opened up today in Albany by appointment only online. I tried to get online. As you know, I said my daughter turned 16 on Monday. I had no luck, so I feel sorry for everyone out there trying to get on there. Rensselaer County is up and running, and they're doing appointments, so they seem to be having a smoother operation right now than our DMV here in Albany. But I'll keep you updated on that, how that goes forward. So there's things that we have to continue to look at. So one of the other things I want to say and give a huge shout out to the volunteers from the community hospice that went up to our nursing home and did chalk stuff on our sidewalks and messaging to our residents at our Albany Shaker place. Thank you for doing that yesterday. It brightened up their day, and I think it put a bigger smile on the workers' face than the residents. So it was nice, and they've done a great job up there. And like I said the other day, we've had, we're at 0 cases right now with anyone that has the coronavirus, which is good, and we continue to test all the workers. The other good news is starting in phase 3, we no longer have to, I said this before, we don't have to test workers twice a week, so it's once a week, and we're hoping to get rid of that very shortly by next week. Because it's it's not comfortable to get done. I don't know if anyone out there has gotten it done. It's very uncomfortable. It's nice. It's not good when you have to do it twice a week. A lot of people don't like getting it done twice a week. So this is a good step in the right direction. And and again, the cost to us, and not just us, all the nursing homes in the Capital District, it's been a huge financial drain on everybody. So again, I also want to say thank you to everyone that I've been working with, all the community leaders in Albany County as we go forward and we continue to put stuff out there. Our mental health support line is still available 7 days a week. Actually, our uptick in phone calls have been more now since we've been opening up, and people have been outside and seeing things differently. So, and some of the things they have talked about, that the feedback we've gotten is all the boarded up buildings. I mentioned this a couple days ago. People are shocked, not just in downtown Albany, but throughout the whole Albany County region. When you see, it settles with people when you're going through Gilliland and Colony and different areas of the county that never seen a bunch of buildings boarded up. So it's surreal. It's eye-opening to a lot of people. And again, we have that line there for you to call, to reach out to people 7 days a week. It's 8 a.m. to 8 p.m. and the number is 518-269-6634. And as always, our 24-hour sexual assault hotline number, area code 518-447-7116. And as always, we have the 211 number in the New York State Hotline, 1-888-364-3065. And again, thank you to everyone doing the right stuff, and please stay safe and healthy.